Hi everyone, welcome to the Egg Whisperers Show. I'm Dr. Aimee, your host. I love talking about fertility. In fact, you can tell I get fired up about it. And recently, I have come up with something that's related to fertility called the miscarriage revolution. There's one thing you might not know about me, and that's why I went into fertility medicine. I went into fertility medicine to help people with miscarriages because of the experiences that my mother had when I was a young girl. I used to literally be in bed listening to her cry in the middle of the night, and I said to myself, I'm going to dedicate my life to helping people who are going through what she's going through right now. And that's why I became an IVF doctor, a fertility specialist, a reproductive endocrinologist, and a miscarriage expert. That's what all fertility doctors are. And we're just not doing enough as physicians in the United States and across the globe to let people know what tests they can do after a miscarriage and even at the time that a pregnancy is diagnosed as abnormal, so that you can take the lessons from the miscarriage, that precious pregnancy, to teach you what you should be doing and thinking about next. These pregnancies, you've probably heard of them called angel pregnancies or angel babies. And it's just fitting that I call this the ANGEL Workup. This is part of my fertility revolution. So I'm going to break it down for you. This should not be considered confusing or complicated. Obviously, going through a pregnancy loss is devastating, but I get fired up. This is a chance to learn. This is a chance to figure out what we need to do next so we can move forward with our eyes wide open, understanding what all our options are. So the A stands for age, autoimmune, and anatomy. Age, why is that important? Well, it's simple. As we get older, especially as women, men too, the viability of our eggs goes down. There are simple tests that you can do. The AMH, antral follicle count, FSH, and estradiol. AMH can be done any day in your cycle, and we know that if the level is low, especially less than 0.6, you might have a higher chance of miscarriage because of genetic abnormalities in the embryo due to egg quality. The FSH and estradiol are done cycle day 3. These are diagnostic tests that also tell us about egg quality. And you can also do a special ultrasound looking at the ovaries called an antral follicle count. The AFC is also a guide as far as what's going on with our egg quality, because every embryo takes an egg and a sperm cell, and we know that if the egg quality is low, we might have a higher chance of miscarriage. So rather than going through another miscarriage without this special test, you can get these tests done by asking your doctor for them if they're not bringing them up. So very important for you guys to get a piece of paper and a pen out. I'm just kidding, you don't have to, because I'm giving you all this information right now, and you have the blog article that goes along with this show so that you can print it out, talk to your doctor about these tests, and make sure you're getting all the information you possibly can about yourselves. Next is autoimmune diseases. I do an autoimmune workup looking at things like Hashimoto's thyroiditis, lupus, and to see if a patient has that, and the other thing is antiphospholipid antibody syndrome. And we also know that celiac disease, for example, can cause issues and be the culprit for people who've had recurrent pregnancy loss. And then the last A is anatomy. You can have a uterine anomaly, like a uterine septum, a unicornuate uterus, a bicornuate uterus. These are uterine anomalies that have been associated with a higher risk of miscarriage. And understanding what's going on with your uterus and potentially fixing it, for example, if you have a septum, can be extremely helpful and may prevent miscarriage in your next pregnancy. Now I want to go to the N, and that's nutrition. You hear me say this all the time, and I know you're rolling your eyes like, stop saying it, but it is so true for you to be the best version of yourself every single day. You deserve to be pregnant again, you deserve to have a healthy pregnancy, and you deserve to take really good care of yourself. So please follow a plant-based Mediterranean diet if you can. Talk to a nutritionist. We know that healthy nutrition also promotes a healthy ovulation, especially if you have PCOS. We know how important a healthy diet is for women who have PCOS. I have the HOPE approach, you guys, and part of the HOPE approach is the E for eating for women with PCOS. If you haven't watched that show, please watch it to learn more about PCOS. And then I already mentioned it already about celiac disease. People who have celiac have a much higher chance of having a miscarriage. So be sure to get tested, follow a gluten-free diet, and see how your fertility can be restored, and you might have a lower chance of miscarriage by doing that. Same thing in men. Men can have celiac disease as well, and this can result in sperm abnormalities such as abnormal shape, low motility, low testosterone, following a gluten-free diet, if you have celiac disease, I'm not recommending this for everybody, could potentially help. And now I want to get to the G. Genetics. Your DNA is so important and it can play a role, and that's why screening both the male and female partners super important, because of how important a role genetics can place. Can place. You know what I'm saying. And at the end of the day, there are tests that you can do. They're simple. Blood tests, karyotype or chromosome analysis on both partners, carrier screen, sperm DNA fragmentation test. Not done on the women, obviously. And then you can also test the pregnancy tissue. If someone reaches out to me and says, Aimee, I'm dealing with a pregnancy that has miscarried, I just want to run over to their house with a kit because I want to study what's going on with that miscarriage. Because I can tell you if the pregnancy has normal chromosomes, that tells me to go one direction with testing. If the pregnancy has abnormal chromosomes, it tells me to go a different direction as far as testing. And if I have a pregnancy that has miscarried and I don't have the answer as to why from a genetic standpoint, then I'm going to go through both lists of tests that I would do because I don't know. So that's why if you have a pregnancy that has miscarried and you are currently pregnant, ask your doctor to do whatever they can to test that pregnancy. The test kit that I use is called the ANORA test, A-N-O-R-A. It's a very simple test with a kit, and you can take the tissue and put it in there. And I have my way of telling my patients how to take it. And I don't want this to be triggering for people. Paula, should I tell people how to collect their own tissue? Sure? Okay. So this is what I tell people. If you're currently pregnant and you're dealing with a miscarriage, what I suggest is you get a sieve or a strainer and put it in the toilet for when you're home about to miscarry. If this happens before a D&C procedure, and certainly if you want a D&C, your doctor can do this for you. Once the tissue has come out, don't worry about anything, meaning like touching it with your hand. You can just take a plastic bag, you lift up the strainer, you grab the tissue and you pull it through, and then you can take it into your doctor, and there's no emergency to do so. It's not time sensitive. Don't freeze the tissue, don't wrap it in paper towels or anything like that. You can just close it up, put it in the garage, put it in the refrigerator until you're ready to bring it in. But just don't freeze it or wrap it in any paper towel or paper or anything like that. Then we'll get results about a week later, and then we'll do a post-miscarriage consult to review the results and find out more as to why the pregnancy miscarried. And about 10% of the time, you may not get results at all, but you'll never be mad that someone didn't tell you that you can actually find out. It's one thing to be told that your pregnancy miscarried because of genetic abnormality, and it's so common, and don't worry about it. But at the end of the day, we are going to worry about it because we're human beings. We think about these things and we want answers. It's something that you'll always, have in your heart as in your mind as far as why did my pregnancy miscarry? And it's so like routine that as women we blame ourselves. I've heard people say things like, it's because I lifted up my laundry basket, or it's because I got in a fight with my husband because he didn't pick up the laundry basket. I'm trying to make a joke for something that's really not funny. But the serious side of it is that people actually tell me that that's why they think they miscarried. So that's why I want them to have a piece of paper that tells them why, so they don't wonder in this way that may seem rational, but it's slightly irrational because it's not possible to miscarry because of that. So now I want to move on to the E of the ANGEL Workup, and that's endocrinology. Your endocrine system can have some abnormalities. What do I mean? Well, I mean things like a thyroid disorder, high prolactin, diabetes. Simple tests, once again. These are simple tests that are part of a preconception panel for my patients. But when someone's had a miscarriage, I'm going to dive a little bit deeper. I'm going to look at a full thyroid panel, including anti-thyroid antibodies. And if I've done a prolactin before, if it hasn't been done in the last year, I'm going to do it again. And the next thing to look at is lifestyle. Your lifestyle can play a role. Women who are curvier might have a higher risk of miscarriage. So I want you to be in the best shape of your life. Consider again a plant-based diet, avoid alcohol, or at least minimally drink alcohol. Avoid completely pot smoking and cigarette smoking, both female and males, and maintain a target BMI. And ask your doctor what that BMI should be, because it isn't a one-size-fits-all sort of approach when it comes to BMI and miscarriage. So talk to your doctor and have a really honest conversation and say, look, what do you think my BMI should be, given everything you know about me, to give myself the best chance of having a healthy pregnancy? And at the end of the day, you want to put the sperm through a sperm boot camp and toss the champagne out the door and start swimming those laps. I mean, I'm serious, but not serious, but kind of serious. And the reason why I'm serious is because we know that sperm health is really important, and we have more and more mounting evidence to suggest that. And that's why having healthy sperm is also important, because it's not just about the female partner. So we shouldn't blame ourselves for miscarriages where we know that it's always out of our control. But doing these tests as part of the ANGEL Workup, part of my miscarriage revolution, will hopefully make us feel better about the experience we had, feel more knowledgeable about the things that we can change that are in our control, so that when we're pregnant again, we're not as nervous or anxious. You're still gonna be, because that's normal. But if you know that you've tested everything ahead of time, you're never gonna look back and say, why didn't someone tell me what my options were? Why didn't someone tell me that I could do genetic testing of my embryos before I did another cycle, before I got pregnant again, to minimize miscarriage? I hope this helped you guys. I hope you guys will go to my website, Miscarriage Revolution, and I hope to see you in class. So join me at eggwhisperschool.com for my next class to learn more about my strategies to improve fertility and prevent miscarriage. Thank you guys. See you soon.